Coming in at number 6 is Trendelenburg Sign. A what sign, I hear you say? Yeah, it's a long word. It's called Trendelenburg Sign. So what is that, I hear you ask? Well, the Trendelenburg test was first used as a test for hip dislocation, but has become a good assessment tool to test for weakness in the gluteus medius muscle, which lifts the leg out to the side. And that movement is known as abduction. So a Trendelenburg sign occurs when a person has weak hip abductor muscles, which lead to the inability to stabilize the pelvis effectively when on one leg, whether moving or standing still on one leg. What you tend to see with a Trendelenburg sign is the pelvis on the opposite side to the standing leg tilts downwards or drops downwards. If the person had normal strength of the hip abductors, the pelvis would remain level when on one leg. A Trendelenburg sign is commonly seen in gym users when they're walking, running, lunging, or stepping. So basically, exercises where they spend any period of time on one leg. And again, this is seen more commonly in females than males, and there's several reasons why that is, and I won't go into it, but there are several reasons why. So why is a Trendelenburg sign a problem? So the reason it's a problem is because, like many situations of instability, it creates excessive wear and tear on the tissues, as well as reducing strength, power, and performance. If performed under enough load for long enough, it can lead to abdominal muscle tears, tightness in the quadratus lumborum on the opposite side. That's a muscle, by the way, a muscle in the lower back, on the side of the lower back. It can cause injuries to the ankle, like ankle sprains, knee injuries such as tears to the anterior cruciate ligament. It could be the medial collateral ligament. It can also tear the medial meniscus. It can create hip injuries and also injuries to the lumbar spine, particularly the lumbar discs and facet joints. So it really is something you want to avoid doing. Sadly, it is something I see every single time I go to the gym, and it's often, I often see it just walking behind someone walking down the street, and it's very, very common. And again, sadly, most exercise professionals are not taught this in their training, so they don't look out for it. They don't know how to correct it. So you may have a Trendelenburg sign and not know, so you won't even be able to correct it. But I will be giving you some tips and resources a bit later in the episode to assess it yourself and potentially be able to correct it. Thanks for watching the Radical Health Rebel YouTube channel. If you enjoyed this video, please be sure to share with your friends and family, or share via your social media. Hit the like button, subscribe to the channel, and hit the bell icon to receive notifications of new video clips from the podcast. And if you want to watch the full episode, completely ad-free, plus premium content, and join the Radical Health Rebel Patreon community, head on over to the Radical Health Rebel Patreon channel at www.patreon.com/Radical Health Rebel. Thanks again for watching.